Thank you very much for inviting me to the event. I'm very pleased to speak, and what I'm going to do is really gallop through quite a lot of information. In terms of the title, it's a critique, it's not a criticism of the Scottish Government. So there are good things and bad things that I think need to be discussed. Good things need to be strengthened, and the bad things we need to remove in the context of a zero COVID strategy. What should underpin it all is really the precautionary principle, because when you're dealing with a virus like SARS-CoV-2, it knows no borders, it knows no boundaries. It doesn't stop in the community and doesn't go into the workplace. It doesn't stop in the workplace and therefore not go into the community. And it'll move into schools, it'll move into hospitality and so on. So we need to have that idea there, and we need the biggest safety margins possible when dealing with a pandemic like this. Most of us have lived through it, although we may have different experiences of it. So we're probably fairly familiar with the way that the debate has been going. But what we're looking for is a hierarchy, and the New Zealand approach was exclude. That doesn't seem to be possible in a number of countries. And then it was eliminate, it was suppress, it was mitigate, and we've got the herd immunity sort of approach. And indeed, in some places, there's been no strategy at all. So if we're looking at what the UK strategy was, which really shaped, I think, the first responses way back in March, and were initially inherited by Scotland, that was about containing, delaying, doing research, mitigating, and keeping the hospitals running at all costs. So there are lots of questions there. The Scottish Government did develop its own framework of principles for COVID back in April 2020. And I'll come back to this at the end. But in that framework, it said it would use the best evidence available. It didn't. And I think there's a lot of things that we can discuss there. So the sort of approach right at the start that one should be looking for is really to go for what might be termed an independent SAGE approach, not the SAGE approach that advised the UK government. And we have some comparators for what's happened. I don't know if you could put up the PowerPoint at your end. But you'll see down the bottom left, there's Norway. And the figures are pretty stark about what happened. If we compared ourselves as Scotland with Norway, there were issues about speed on lockdown, there were issues about closures, there were issues about travel controls, there were issues about economic resources, lower socioeconomic deprivation levels in Norway, issues about financial support for both employees and employers. All of those things influenced what happened. And clearly, we simply don't compare with a country the same size as ourselves, a similar but not identical geography. We could look at Taiwan, which has got something like 23 million people, and its recorded COVID death figure at the moment is 600. We could also look at Korea, New Zealand, and Australia. They've got different responses. What we can say is if we looked at England and just simply looked at death rates, we're doing better than England, because our death rate at the end of January was something like 122 deaths per 100,000, whereas in England it was something like 134. So you could say we're doing better. Perhaps the better way of looking at it is we're doing less badly. But how can we judge Scotland's performance when we know that the virus has no borders and no boundaries? Three things I think that we can look at that link in with the sort of government structures, the resources, and the planning. The first thing would be faults with what Scotland could not control. Faults with what Scotland could control. And that would be pandemic planning came in too late. There were early warnings ignored. And on the PowerPoint, you see up the top left, there's the World Health Organization information. There were papers being written in 2007-8 about the issues associated with viruses, not just the flu virus. And there was a lot of planning that went on there. And that wasn't picked up. So initially there was limited foresight and vision. And we also ignored the high levels of pandemic expertise in Scotland. People like Devi Sridhar and so on, with enormous expertise. The initial managing the pandemic approach was flawed. There was an over-reliance on and far too trusting approach with regard to UK advice. So we relied on the UK government when we shouldn't have done. I think we put too much weight in the Chief Medical Officer's reports, and there were major problems with what UK agencies and experts were saying about the pandemic, particularly Public Health England, which has had enormous influence and still does, I think, in Scotland, NHS in England, with the leads there, the influence of the business and industry departments, the role of the Health and Safety Executive, which is obviously a reserve body controlling workplace COVID controls up to a point in Scotland. Initial lockdown came too late, about which there's been much discussion. Information flow has been too limited, and we could debate the Edinburgh Nike cluster there. And there have been a whole swirl of issues around care homes and care workers as well, and the protection that they receive. So those were things that Scotland could have done better on. But of course, secondly, we were constrained by things that we couldn't control. And those are pretty central too, if you think about the position in Norway and so on. Limited borrowing powers, economic support for furloughs, no border controls, although Scotland does control the public health bodies, and we have a police service that's independent. And again, perhaps that's something to discuss later. There were limits for the budgets that were available for local authorities and NHS Scotland, which had some sort of impact. And as I've said, we had no control over the Health and Safety Executive. But thirdly, if we have a look at the pre-pandemic position in Scotland, then we were starting from a better position because public health hadn't been run down in the way that it had in England. It was better planned and able to operate up to a point, and again, this will be something to discuss later, a better test and trace system earlier than England. The NHS boards and local authorities were able to respond better. And I think Public Health Scotland, Health Protection Scotland, and so on, were in a better state than some of those bodies in England and were better coordinated. And there was certainly more engagement up to a point with workers in terms of looking at how you can control transmission in the workplace. But there was still flawed collaboration, I think. So guidance, although better, was limited. If you look at the PowerPoint then, you need to try and bring together all of the factors that are in the top left group. So it's about what we're doing ourselves, what we're doing in the workplace, what we're doing in the schools, and the sort of measures that we take. And we were far too trusting at the beginning about how the virus was going to operate and what we could do to control it. So you may or may not recall the big debate about 2 meters. There was an ideological attack mounted by Westminster to dispense with 2 meters for solely economic reasons. And the science and the evidence for that was extremely poor. And the reviews that were produced were very, very unbalanced. Yet the Scottish government accepted, I think, the guidance of the UK government and went for the 2 meters and less rules at the beginning, although the position has changed. If you look at what we said about masks, so there was concern about transmission, and the focus was almost entirely on droplets and on fomites cleaning surfaces. There was a big problem with the sort of reviews that were done about face coverings and the appropriate PPE. And that's rolled on all the way through. And we're still here now with discussions in Scotland about whether hospital workers and care workers and others have got the best PPE, the highest standards. So I think there are real issues there. And that links in with ventilation. And at the beginning, we had references from the Scottish government about hygiene. And ventilation as such was never picked out. It was really neglected in the context of schools and in the context of workplaces. And even in February, the chief nursing officer was still talking about a droplet threat, not an aerosol threat to people in the community, to people in schools, and to people in workplaces. So that was inadequate. Perhaps on the bottom in terms of test and trace, although in the summer of last year, there were difficulties in terms of the quality of the data and gaps in the data. That has improved, but is probably not all that it should be, but definitely better than in England. And then we've seen the development of the vaccine, which of course the supply has been controlled initially by the United Kingdom, and that's had a big influence on what's gone on. And there's been a very high reliance on the Joint Committee on Vaccination and Immunisation with its age-based approach. Now, this goes back to the point about best evidence available. There are other approaches that exist that draw on exposures of groups and that also raise questions about equity to protect, for instance, teachers and education staff, care workers and so on earlier or at all. And this all then accumulates in where we started as well in terms of action to stop the virus moving around. So here we are faced with what do we do about quarantine? Can we or can't we close the borders? So where are we now in Scotland to sum up? We've got a much more precautionary approach than England, although that may be a pretty low benchmark. In April 20th, in 2020, April 2020, the Scottish Government did produce its framework. And although it never talked about zero COVID, it did talk about saying there's no such thing as an acceptable level of loss from COVID. That's a critical point. It's got a clearer policy and practice. It's got better guidance and action on COVID in the workplaces, working at home rather than going to work, stopping non-essential work, phased education returns, not privatising to the same extent test and protect, having local controls as well. And we've got the evidence that sort of control measures that have come in have done better than in England. But of course, we simply don't compare with Norway. So what we really want in this context is a zero COVID policy that draws on those precautionary principles, that uses the best science available that's not locked into some of these strange groupings in England. It builds on what works and puts right what has failed. And I would have to say that many of the problems wouldn't have emerged in an independent Scotland if it had pursued the same policies as Norway. But of course, it might not have done. Thank you.